TravelWell was started in 1988 because we saw a need to see patients prior to their travel to give them information about health overseas, particularly when they go to the developing world, and in order to see people either returning from travel who are ill or new immigrants and refugees who have begun to settle in Georgia. We see several thousand people who are traveling from the Atlanta area, either for leisure, for business travel. We see a lot of students, a lot of Emory and other professors in town, as well as people who have immigrated to Atlanta and are going home to visit friends and relatives. So we see lots of different types of people. Well, the first thing we do is talk to them about immunizations. We make sure they're up to date with their routine immunizations that they should just have living here or traveling anywhere. Then we go through the special immunizations that may be recommended or required for travel. Then we go through things such as what we call vector-borne diseases, or those diseases transmitted by insects, such as mosquitoes. We talk about safe food and water, and a lot of other issues that come up for people who are traveling. I think most people still think when they're going to more exotic places that it's like going across country or to France or England, but things can be very, very different elsewhere. And it's important that people have a feel for the kind of environment they're going into, culturally as well as health-wise. One of the most common things that travelers get after and during the time they're in the developing world is traveler's diarrhea. We see that quite frequently, and that's probably the most common illness that we see. Respiratory infections are very common. And then we actually see diseases like malaria and dengue fever not uncommonly. I would say areas of expertise are all of travel medicine, any of the kinds of ailments that people acquire when they travel, those that are acquired prior to immigration, for example, tropical diseases, and illnesses that are acquired during crossing borders. For example, when there are outbreaks in the world such as influenza H1N1 that we had, SARS, or exotic diseases, for example, when we had the anthrax problems, bioterrorism.